Okay. Hello, everybody. Welcome. We were just talking about what number this seminar is, and it is our 8th seminar. So I'd actually be interested to know how many people have been here for all 8. So put in the comments if you have, just out of interest. So I'd like to start off by a land acknowledgement, please. So as we gather, we are reminded that Guelph is situated on treaty land that is steeped in rich Indigenous history and has been home to a variety of peoples over the millennia. As settlers, we are grateful for this opportunity to meet here tonight and to thank all of the generations of people who have taken care of this land for thousands of years. We acknowledge the historic Mississaugas of the Credits, the First Nation people who were the treaty signatories of the territory on which we are meeting today. Treaty number 3, known as Treaty Between the Lakes 1792, remains today. Today, this area has been home to many First Nations, Métis, and Inuit people whom we share this land, their achievements and their contributions as a shared community. As a community, we have the responsibility and the stewardship of this land for which we live and work, and we're reminded of the Dish and Spoon Indigenous law that ensures that we all have enough substance for all of the Earth's creatures. We offer this acknowledgement as an act of reconciliation between Indigenous and non-Indigenous peoples of Canada. So hi, everybody. My name is Tracy Curtis. I am the chair of Bracelet of Hope and a very proud Rotarian and community member here in Guelph. We would like to thank you all for joining us here today. But most of all, actually, I'm proud to be a woman. Yesterday was International Women's Day, and we think that this should all be a week, not just a day. So thank you for joining us. I did want to talk about International Women's Day because it's not a secret that COVID has affected women differently than it has affected men. So 70% of our healthcare workers and first responders are women. Women earn less than men. Women make up the majority of single-family households. Women dominate sectors that have been affected most by COVID, such as food services, retail, education, and childcare. Violence against women has been on a steep incline globally, as well as in our community. So let's all hold that close in our hearts tonight and think, how can we be supportive of this and make a difference moving forward? Last night was the Women of Distinction Awards that was in partnership with International Women's Day with Innovation Guelph and YMCA, YWCA. And Annemarie Zadlik was an honoree, as well as Cindy Forsyth, who you're going to hear about in just shortly about with the Integrated Youth Service Network. And Charlotte Yates, the president of the University of Guelph, and Queen, who is the community engagement coordinator with the Guelph Black Heritage Society, and as well as Genevieve Southerns. Genevieve and her friend started the Guelph Box, and they donated 5% of their donations, 5% of their proceeds to charities. And as a 19-year-old, donated over $30,000 back to our community over COVID. So these are incredible women leaders in our community that I'm very proud to stand beside. So tonight, in celebration of International Women's Day, we are raising some money in our community by signing up for a team for 2021 Virtual Run for Women, brought to you by the Love You by Shoppers Drug Mart program. This year, Walk or Run will be on July 4th to July the 11th. So in 2020, we were able to raise more than $100,000 for women's mental health programs of the Canadian Mental Health Association, Waterloo and Wellington, helping Canadian women have access to care and support that they need during the COVID pandemic. So please consider signing up for the run, and you can do that at www.runforwomen.ca and choose Waterloo as your city. So thank you, everybody. I would like to just introduce you to Marva Wisdom, and then Marva's going to give introductions to our panel for tonight. So Marva Wisdom is our moderator for this evening. Marva is a senior fellow at the Monk School of Global Affairs and Public Policy at the University of Toronto, and a senior equity and leadership practitioner. Marva is our City of Guelph's external lead consultant towards eliminating systemic racism. So as a keynote speaker, facilitator, researcher, she helps her clients embrace diversity, demand inclusion, and fight for cultures of belonging. So Marva actually has co-written this book, so I'm not sure if you all
no.
have a copy. So yeah, so Collecting Courage, Joy, Pain, Freedom, and Love. I'm very proud of you, my friend Marva. So congratulations on your book. Everybody grab a copy and enjoy the night. And thank you all for joining.
Aww.
Nice, nice.
Geez, thank you, Tracy. Thank you so very much. You're so very kind. And last night you were so eloquent, both you and Helen, as you spoke about Annemarie. And I'm going to stop talking about her because she doesn't like that. I am so delighted to be your moderator tonight. We're going to have fun. We're going to answer lots of questions, some of them serious, some of them not so serious. And we are all in this together. It's been a year. We just celebrated that that first anniversary, and we are rounding the corner, and you're going to hear very much more about this tonight. I am very pleased tonight to introduce Annemarie and Helen, our two recurring panelists, answering your questions about mental health implications of COVID-19 pandemic. And first, of course, Dr. Annemarie Zadlik, who we all know by now. And if you haven't visited her Facebook page, well, you're in for a treat when you do. She is a primary care physician in Guelph, of course, providing comfort and guidance to thousands during this pandemic. And elsewhere. So we're very, very excited. Annemarie is going to be sneakily answering some questions, some of the questions that you may not hear us share, because we're going to try to go through as many as possible. And she's great. So she'll be answering questions, not only typing it out, but also live. And so just wanted to let you know that if your question has been answered, just look and you will see some responses from Annemarie. Our second panelist that I spoke to you about is Helen, of course, and Helen is a CEO of Canadian Mental Health Association of Waterloo, Wellington. She is a lifelong advocate for increased awareness of mental health and has dedicated her career to mental health and to help us strengthen. And we all know how challenging this COVID-19 has been as related to mental health. And we are in some ways dedicating this session primarily to mental health, although we will be answering all your other questions. And tonight, we're happy to be joined by two very special guests. The first one, I know a little bit. His name is Justin Wisdom, born and raised in Guelph. Yes, we are related. And he's a current owner and operator. And actually, he started Wisdom's Jewelers studios here in Guelph and in Toronto. He's an award-winning entrepreneur, and Justin also has a strong belief in giving back to the community. He's been instrumental in both the Guelph General Hospital campaign and most recently has been part of the Mask Off campaign where he lent his support. And you will see, you saw Tracy wearing a sweatshirt and you see Helen wearing a sweatshirt that says, "How are you really?" It was a fundraiser for the Integrated Youth Services Network campaign. And speaking of that IYSN campaign, the person behind this wonderful campaign is our second guest, Dr. Joanna Henderson. And Dr. Henderson is Executive Director of Youth Hubs Ontario, the provincial plan to create a new model of care for youth. Dr. Joanna Henderson is director of the Margaret and Wallace McCain Center for Child, Youth, and Family Mental Health. And she's also interim emerging adult. She's an interim director at CAMH, and she's also senior scientist in the Child, Youth, and Emerging Adult program at CAMH. Boy, that's a mouthful. I almost didn't make it through. Not only that, but she's associate professor in the Department of Psychiatry at the University of Toronto. Are we ever happy to have you both here, with Dr. Henderson just speaking to youth and Justin speaking as a young entrepreneur in his experience as a youth going through COVID-19. So let me just share a few housekeeping rules, and then we want to get to what you want to get to, and that is answering your questions. So tonight, you may be joining us either on the Zoom webinar link or via Facebook live broadcast. We are ready to receive your questions for either platform. So we ask you to feel free to, again, type your questions, as I said, into the question and answer section of either Zoom or Facebook. And we'll do our best to answer as many as we can answer tonight. I just want to let you know too that if we can't get to your question live, we'll provide some useful websites for you, and we keep updated information there. Not only us, but partners, certainly Canadian Mental Health Association, as well as our I'm sorry, I'm just trying to say our public health as well. You will find those are helpful places to get information. We are recording this webinar, and it is posted on the CMHA Waterloo Wellington webpage, and it is also going to be posted on the Bracelet of Hope webpage, and of course, it will be posted on Annemarie's Facebook after this webinar is over. Maybe give us a little bit of time before you see the posting. We know you might have lots of questions tonight on vaccinations, and we are hoping that Dr. Zajdlik can answer many of those questions, and again, via the Q&A. And we look forward to chatting with you tonight and hearing from you, answering as many questions as possible. Again, we're in this together. And what I'm going to ask is if both Justin and Joanna can start us off, and I'm going to say Joanna tonight, and I'm going to say Annemarie. And I'm just going to ask Joanna if you have some opening thoughts to start us off, and then I'll ask Justin for some opening thoughts.
Sure. So thank you very much for having me here today. I'm really excited to be part of this panel. This has been a very difficult time for young people. And a year ago, we couldn't have anticipated what the year ahead held. And I think, I just want to make a couple of brief comments. Everyone in their own way is struggling in the context of the pandemic. It's challenged all of us, but young people, youth, adolescents, young adults, they're particularly facing some challenges. At this time in their lives, young people are moving through a set of kind of developmental tasks and developmental milestones that have all really been uniquely impacted by the pandemic and the necessary public health restrictions. So young people are, they're moving away from their families. They have a really strong sense of drive to connect with their peers, to connect with a sense of community. They're getting their driver's license, they're getting their first jobs, they're moving into career spaces, they're moving through education. And all of these things have been disrupted by the pandemic. And so when we think about the different ways in which segments of our community have been impacted, I think it's really important for us to think about how teens and young adults. Having said that, of course, their teens and young adults are also have a lot of strengths. And so I think, what I hope we'll talk through some of tonight is really how, both within each of us and within the young people and across groups of young people, we see both the struggle and the strengths. And how do we actually leverage those strengths? We bring those strengths to the forefront to help young people cope. So I'll leave it there for now and circle back after.
That's great. Thank you, Joanna. We look forward to hearing from you. And so I'll ask Justin now. Justin, I know when Tracy reached out to you and suggested you as a panelist, what went through your mind, and just share a few of your thoughts with us.
Well, first of all, just being able to be in the presence of you amazing women here, it's definitely a pleasure. And the major thing was being somebody that's in this community, and I guess being a business owner as well. I wanted to be able to share some insight in regards to some of the business owners that I kind of run in the same circle with, and some people who are around my age and what they've been kind of dealing with throughout this time, right? And I think one of the biggest takeaways that I could get from a lot of the people who are around my age would be empathy is probably one of the biggest things that we really need to try to push forward and use to get through this time, which is going to be understanding that everybody isn't going to be going through this situation in the same way that maybe some other people are, right? Because, throughout this pandemic, there's been a lot of people who have been able to continue working. Some people haven't. Some people's businesses have done a little bit better. Some people have lost work. But in the end, being able to understand where everybody's coming from, what people may or may not be going through, is just being able to, open up a conversation and be able to be empathetic to what people may or may not be going through. I think that's very important.
So how are you really, right?
Yeah, exactly, and that's the main thing. You ask sincerely and look for a genuine answer, right? That's the real key, because we don't know what other people are going through. So we ask, how are you really? For sure.
It's wonderful. Thank you so much. And speaking of how are you doing, we have a poll here that we're going to ask folks to respond to. And the poll is multiple choice. How are you doing? Whether to say I'm struggling. And we've done polls before, and we find that they're a great way for us to gauge how you are doing. And some say, meh, I'm not really sure. Some say I'm okay actually, and others say all good. So we'd love for you to take a few seconds and respond to those polls, and then we'll provide you with the answer. And in the meantime, while we're waiting for the answer to come up, and I'm going to jump in, I'm just going to ask one question. And I'm going to ask this one to Joanna. The question is that my daughter missed her high school prom, graduating her graduation last year. And she started first year university completely online, which is sort of a challenging thing for any young person to do. And so the question is, how do you help your child? How do you speak to your child that's going through these kinds of challenges and stresses? And I imagine there are a number of young people that are going through that. Joanna?
Absolutely. And it'll come back to something Justin said, which is really the critical importance of empathy. And listening and finding time to have those kind of real conversations with your child, and creating the opportunity where you're just together. There isn't pressure around the conversation, but where a teen can just sort of share. I think the other piece is, these are experiences that a young person didn't have. They may have had a lot of expectations about what that was going to be like, but sometimes parents play a role in creating those expectations. Like, you should be having a different kind of experience, which sometimes isn't as helpful to teens. Parents feel like they may have had great experiences and their child is missing out, but their child hasn't had the experience. And so parents also need to be a little bit careful about maybe conveying a sense of, you've missed this really important thing. Of course, acknowledging and validating young people's experiences is also really important. So when they are talking about it, it's really important not to say like, oh, there'll be other opportunities, you'll get over it, but really try to have that empathy, try to understand and validate young people's experiences.
Thank you, Joanna. And the second half of that is really interesting. The second half was about how does she grieve the ritual? So you answered that quite beautifully, because it may have been a ritual to her mom, her parents, her family, but it's not a ritual to her yet necessarily. So thank you for that. That's just great. And so we have the poll in, the responses. So we have 48% says I'm okay actually, and 7% said I'm all good. So, and 30% say meh, and 16% says I'm struggling. And so if we look at, it's more than 50% that's not feeling too badly, that they're doing well. And I think as the vaccine rolls out, maybe that meh and I'm struggling might get a little bit better. Annemarie, your thoughts around that poll?
I think that's improved from the previous polls, that more people are doing well. And I do think that's because there's a renewed sense of hope. I know I certainly am feeling that in the last 10 days or so. We are being inundated with vaccines now in our public health unit across the country and in the province of Ontario. The main concern we're going to have now is how do we get them into the arms of everyone? So, and we're way, way ahead of schedule. Everyone will have a vaccine at least by September, probably well before that. And knowing that, we're sort of all feeling like, oh, there's an end run here. We're actually doing it. The miracle of vaccines have arrived, 4 of them so far. And we're also seeing the vaccines do incredible things in other countries. So yeah, there's lots to be optimistic about.
Great. Thank you. Helen, is there a good place to get resources for young people who are okay but are struggling with missing their friends?
Sure. I mean, we have a lot of resources actually online for folks. If you go to our CMHA website, you'll see tons of resources there, but we've actually also created a specific website for people to get COVID resources and to find them really easy. That's called hereforhelp.ca. So here, the number 4 help.ca, and we've organized that website based on age. So what resources are available for kids, for youth, for parents, for employers, for farmers. We have it organized by different populations. So it should be really easy for people to find what they need. There are also a ton of links on that website to other websites where you can get access to virtual care. You can register for some online programs like Bounce Back, for example, and just find all kinds of great apps as well, which help us manage day to day. So that's probably your best one-stop shop.
That's great, because I know that there's been a lot of people, some of the conversations that I've had where people are really curious on where they can find the help, and like what you've been doing is obviously, you know, amazing. It's working wonders for some of the people in the community there. That's awesome. Love that.
Well, Here 24/7 is always there if people prefer the phone, right? And our Here 24/7 staff can walk you through it. We're very fortunate with our Here 24/7 service, but there's also times that people don't want to really talk. They're not ready to talk to somebody. They just want to surf the internet. They just want to see what's out there. They just want to think about things for a bit before they're ready to make that first step to talk. So both of those options are always available.
And so we'll ask someone to drop that, the website in the chat.
Yep.
Just to, and then we'll repeat it later in closing. I know Tracy, when she's closing, she'll be able to share that with you. That would be really great. Annemarie, someone would love for you to answer this one live. Are folks who have an EpiPen able to get the vaccine?
Yes, definitely. So an EpiPen is usually for an allergy, most commonly a food allergy, shellfish is very common, or an insect allergy. Very rarely do we use EpiPens for other things, but the only allergy you need to be aware of is an allergy to the ingredients in the vaccines. You can find out the ingredients in the vaccines by looking up the vaccine online and just put the name of the vaccine and ingredients. The most common allergic reaction is to PEG, polyethylene glycol. Very few allergic reactions is what we're seeing around the world, which is really great. You may be set aside for a little bit longer at a vaccine clinic if you do have an EpiPen or if you have a history of allergies, but that's because we're taking the utmost of precautions. If you have had an allergy to the first vaccine, that's another reason to reconsider getting the second, possibly reach out to your healthcare provider. And there are now allergists that are stepping up to be consultants and to do phone interviews or phone consultations with people who are concerned about a pre-existing allergy. But essentially, allergy to the ingredients of the vaccine, very uncommon. Allergy to the first shot. Otherwise, go.
Go get the vaccine. That's great.
Get the vaccine.
Thanks,
And any
Annemarie.
vaccine is a good vaccine. The first one you're offered, take it.
Okay, that's great. I see something in the chat as well. We have some additional information. So we talked about hereforhelp.ca, where you go to, but if you're in crisis or want to talk over the phone, in the chat, we have the number there, or you can go to CMHA Waterloo Wellington's website, 1-844 HERE 247. Okay. And
That's
it's in the chat for you to get that information. Can you go ahead, please, Helen?
I was to say that's the Here 24/7 number.
Yeah,
So
with the
anybody that's at
1-844.
risk, don't hesitate.
Yeah.
If you're at risk in any way, please reach out to us. Or if you're concerned about someone else who's at risk, call us about them as well, and we will respond either way.
Wonderful, thank you. I have another question. This question is, with Brazil surging in the number of cases, over 75,000 per day, do you think we will deal with more variants in light of the fact that it's still ramping up, and we already know that Brazil variant is spreading internationally? And will the vaccines protect us against the variants? We're going to answer less vaccine questions tonight, but we're going to answer that one with certainty, and then we're going to jump on to some questions and getting our mental health in shape.
You want me to answer that, Marva?
Yes, please, Annemarie. Vaccine question. Thank you.
Okay. So we know a lot about the B117 variant, which is the United Kingdom variant. We're learning more about the South African variant. So far, so good, and in Canada, and that's because we're keeping our level of community transmission down. So the best way not to get a variant is not to be exposed to COVID-19,
Yeah.
which is why we still need to adhere strictly to our public health guidelines, that 3-layer mask with a middle layer of polypropylene or a level 2 surgical mask, staying 6 feet apart. It was wonderful doing my power walk at lunchtime today. So many people were out walking, and we become very polite as Canadians as we kind of move to one side to be 6 feet away from somebody who's coming towards us. Let's keep those up. Do not gather inside just yet. Stay in the zone, the provincial zone that that the province has your community in. And I think if we do that, we won't see a surge in a significant surge in variants. And we know that the AstraZeneca vaccine is effective against the UK variant, that the messenger RNA vaccines, Moderna and Pfizer, seem to be effective against the South African variant. We'll have to wait and see what's happening with the Brazil variant. I don't think it may have been found in Canada. I'll have to look that up to see if those variants have been found in Canada. But as this virus replicates, we are going to see more and more variants. The newer vaccines, the messenger RNA vaccines, can be pivoted really quickly to respond to a variant. And that's excellent news. There's one in particular coming into Canada probably soon called the Medicago vaccine, it's plant-based, and these guys can create a new vaccine with a different configuration based on the variants within a matter of days. So do not worry about variants, just adhere to guidelines, line up for that vaccine, get the first one made available to you.
That's great. Thank you so much. And you spoke about exercise and getting out in the sunshine. I was very jealous today because I thought I wouldn't get out for a walk, but I was able to. So I want to talk to Justin, ask Justin a question very briefly about what physical activity has meant for your mental health in the kind of high stress work that you do.
Well, I would say, like, regardless, like, I always try to be somewhat active because it's always great for mental health to be able to get the blood flowing and get, you know, everything pumping. But currently, given that I can't go out and interact with some of my close friends or whatever it is, it's been really important to make sure that I at least get out for a walk. And then in addition to that, make sure that I'm not staying cooped up too often, where I can actually, like, you know, make sure that I'm getting fresh air, getting a little bit of sunlight to make sure that my mind is in a good place, right? It's just so important.
Yeah, Helen will be excited about that because I remember her talking about that a lot on our last call. Thank you, Justin. The question I have here, I'm going to ask Helen if she could respond to it, and then maybe Joanna could add some of her expertise in this area. This person says, I am a child and youth worker who's working with vulnerable teens. I'm finding their biggest struggle is social isolation. When I try to engage them in virtual social groups, I'm finding Zoom exhaustion is keeping them away. Depression symptoms are rampant, and I feel like I'm just trying to keep kids alive. Any ideas about how to engage them differently? Helen?
Really tough question, and actually totally true in terms of what's happening with our vulnerable youth. We're seeing it across our youth shelters, amazing places like Wyndham House. We're seeing at some of our other shelters as well, like Hope House. And again, when you think of vulnerable youth, they don't have some of the family system and networks of support. Many of them aren't at school as well. So those are built-in structures and built-in support mechanisms that most youth and families have. And so our vulnerable youth really sometimes operate without that safety net. So thank God they have a child and youth worker who is really concerned about them, connected to them. And I'm not exaggerating, can literally be a lifeline. I think really continuing to maintain that connection, do everything possible to try and bridge. If Zoom is not working, then offer some face-to-face support. There are ways to offer that face-to-face support in ways that still maintain the public health guidelines, that are still very respectful of people's safety. I can tell you our offices, for example, at CMHA are open. We're seeing people face-to-face because we have to. It is literally a life and death issue for people. So to really continue to offer that much support and care, and to know that there are people beyond you as well to help out, for example, here 24/7 and other informal networks as well. So continue to make sure that people know that they can reach out literally 24/7, as well as having amazing child and youth support as well. Joanna, what else would you offer?
We're hearing the same kinds of things, and I think being flexible around like phone, texting, chatting, depending on your context and your organizational policies. But we do hear from young people, they really like to do the chatting, texting pieces, but even sometimes phone is preferable over Zoom. I think being creative, we've been really fortunate to partner with young people across the province to rethink how we're connecting. And so we definitely hear there are some preferences for individual, preferences for face-to-face, but also doing some innovative things like meeting outside, where you can maintain those social distances if that's appropriate for your context, like your organizational context. That can be really helpful. And the last thing I'd say is just self-care is really important. As a mental health professional, it's okay. It's actually essential to take care of yourself too, because the burden you're carrying is significant, and reaching out to your own peers for support and doing the other kinds of things that might be helpful to you is really important as well.
It's a good point,
Thank
because you don't want people feeling alone with that, right? That's too much responsibility. We're a system, we're a network, we're all really here to support each other and to support those vulnerable youth literally around the clock.
This might be a good time to just share a little bit, Joanna, about the youth hub.
Yes, absolutely. So, and I mean, part of why I'm thrilled to be part of this today is because Guelph Wellington has just been such a fabulous community to work with, and to see all of the ways you've come together. And you mentioned Cindy Forsyth before, and Helen and others who have just done incredible work. So the Youth Wellness Hubs Ontario model, the model that you're building here, is really that one-stop shop model for young people that's been co-created with young people, where we're really not trying to like divide young people up into a bunch of different kinds of services that we spread around the community. But in fact, we bring it all together into one place where a young person can just walk in the door or reach out over Zoom or phone and say, like, I need support. And we as the system figure out what's going on, how can we support, what are the services we need to have in place, and really pays attention. And we've seen this over the pandemic, right? The interconnection between economic stability, social functioning, like social isolation and feeling a sense of belonging, mental health, substance use, health, physical health, all of these things fit together. And so it's really about, co-creating with young people these spaces in our community where we come together as a system to meet those needs. So yeah, it's been such a thrill. And over the pandemic, I just have to say, at the beginning of the pandemic, there was a real temptation for people to retreat to sort of like the traditional experts to solve, like, what are we going to do? And we quickly just said, you know what? We need young people at this table. We need youth to co-create with us the solutions. And I think that's been I've learned so much from the youth we've had the privilege of partnering with. So I think that's another piece of like how to think about what services should look like. And you've done such great work in Guelph Wellington around that as well.
That's
Well,
awesome.
we've appreciated all your leadership and support, Joanna. You've got the Provincial Lens. So locally, what this looks like is there's going to be 7 physical youth hub sites for youth to be able to walk into, 4 in the County of Wellington, 3 here in the city of Guelph. We're building as we go. We're building the plane as we're flying it. We don't have a lot of funding yet, but we are really advocating and working on it under the leadership of Cindy Forsyth, who has been an absolute driving force for this project. I have no doubt we're going to achieve it. And it'll really be any of those 7 hub sites, a youth can walk in and get anything that they need. And that's going to really increase their wellness, their resilience, and reduce the risk all around. So we're super excited about this work.
So Justin, would something like this be helpful to those folks that you know, or as you were growing up at Youth Hub?
Absolutely. Like even right now, like there are some people that I speak with on a regular basis just to check in to see how everybody's doing, and making sure that they have a few more outlets, I think, is so major, right? And the fact that they can possibly connect with somebody, obviously safely social distance, makes a huge difference, right? Because that face-to-face, even if it's somebody who is a professional, it's really something that could help, right? So I think it's amazing. Absolutely.
Great. And speaking of that, you were talking about face-to-face a moment ago. The next question is about someone who's a child protection worker and struggle to connect youth and families to counseling support, as it's not face-to-face yet at most places. And the youth are not interested in phone or virtual. So they're asking, are there any ideas when face-to-face counseling may resume? Helen?
It's really an individual call for each agency. I know we have not discontinued face-to-face service at all through the whole pandemic, because we literally see really ill people that need our care and support. We're providing injections, we're seeing people that are actively at risk. So we have had to maintain that core. But of course, we also have an obligation to protect our staff and our clients with PPE and supplies, right, which we have the luxury of getting. So depending on agencies, some agencies are smaller, they don't have access to supplies. It's just a different kind of risk framework that they're in. So I always try to give as much compassion and understanding, because we are a CMHA, we're a very large agency, and we have some things maybe that other smaller places don't. But I do know that there are opportunities either through schools, through colleges, through universities, through your family doctor's office, and through our counseling partners. Keep knocking on those doors, because absolutely you will be able to find somebody who's going to be doing face-to-face care.
Thank you.
Nice.
Annemarie, there's a comment from someone here that mentioned that you've been a lifeline to them, and I just wanted to share that, and also share a message from Marty, who just hats off to you, Annemarie, and Helen, the professionals on here, and the other guests who come on for this event, and how important it is. I just wanted to share that with you. A question, and maybe you can answer this, Joanna, and I know Cindy is listening in, and she might want to type something. Shout out to Cindy in the chat. When should the youth hubs be up and running? Where will they be located? And if you can't, Cindy will answer it, and then I will respond to here. I'm putting Cindy on the spot without her even giving me permission.
So I will let Cindy has all of the details, but I know that the Guelph Wellington sites are, actively moving towards that, and I think have opened. And then I would just flag that across the province, in case you have people who have connected today from other parts of the province, there are 10 hubs that are currently open, including one in Niagara region, so Welland, a couple of sites en Français. We've got a Francophone site there, as well as a non-Francophone site. And then we have other communities across the province as well, Toronto, Malton, Chatham, Kent. These are kind of be the southwest kind of communities.
That's pretty awesome.
So in Guelph, we have 3 sites, the University of Guelph, the YMCA, and CMHA building, which we are constructing, which will not be ready for another 18 months, but that will be at the 3rd site in Guelph. And then in rural Wellington, we have a site in Fergus, we have a site in Erin, we have a site in Palmerston, and when we have a site in Mount Forest. And not all of them are open, but those are our physical locations.
Thank you, Helen. That's great. I forgot. I should have. Let me just say also, the one in Guelph, that's the one that used to be where the old McDonald's was on Woolwich Street, right?
That's right. That's where our new building will be, on Woolwich Street.
That's awesome.
And we have a pretty aggressive capital campaign to fundraise for that building, which will include money for the youth hub, as well as the rest of the building, which will be children's mental health services for CMHA.
Awesome. Thank you. Question for you, Annemarie. As my mother's caregiver, is it possible for me to get my vaccination as a 63-year-old? I'm my mother's caregiver, and I know that I can't get it. Can you change that? No, I'm joking.
Okay, so I just answered that in the Q&A.
Did you?
But yes, if you go onto the public health website, and I know Anne very well. Nice to see you or hear from you tonight, Anne. She is in Guelph, Wellington. If you go onto the Guelph Wellington public health website, you can find the area where you can register, and there's a drop-down menu there that tells you whether or not you qualify to register in phase 1 or phase 2. So I do know that that people who are the primary caregiver for their parent or loved one over 80, if that loved one is at risk, especially if they're in a congregate setting or long-term care, that they are getting vaccinated. So log on and see if that helps. Remember, we're also starting phase 2 in Guelph, and we're looking for people to register online who qualify for phase 2. Look on the public health website, look at the drop-down menu, and if you're there, log on. We're trying to locate, I'm taking a little bit of extra time here, Marva. We're trying to
That's
locate
okay.
everyone who's over 80 and now everyone who's over 70.
Yeah.
People over 70 may not have access to internet, may not have email, and it's more difficult to register if you're not computer savvy. So please reach out to people you know that are over the age of 70 who may not be able to register on their own or may not know that they can presently register. And Marva, can I answer one more question?
Yeah, absolutely.
That it actually came in on the Facebook page.
Yeah.
Someone was asking, they're a person who is eligible to get the vaccine in phase 1 or phase 2. I think they're phase 1, but they're on maternity leave, and so they feel kind of guilty about getting the vaccine now instead of leaving it for someone else who may be at higher risk. If you are offered a vaccine, get the vaccine. No heroism here. We all need to get vaccinated as soon as possible. So get in the line. You are doing your community a favor by being vaccinated as soon as they call on you.
And some folks are asking about choices of vaccine. Should they wait for another choice, even if it's their stage? No. You need to get it now.
Definitely not.
Get it when you're asked.
Yes, take the vaccine that's offered to you. Really, all the
Yes.
vaccines that are available now, there's 4 of them that are approved for use. They're really all the same in terms of what they do to reduce transmission in the community and what they do to decrease hospitalizations, death, and serious illness from COVID. So some people are saying, well, the AstraZeneca vaccine is not as effective as the messenger RNA vaccines. Well, that's kind of in the research setting, but in the live setting in other countries that have had a lot of experience with the AstraZeneca vaccine, it's actually showing after the second shot to be 80% effective. It's almost the same as our messenger RNA vaccine. So do not hesitate to get that vaccine if it's offered to you. We're going to try to reserve the Pfizer and Moderna vaccines for folks who are at higher risk, who have chronic illnesses or over the age of 70. So do not hesitate at all when you're called on and you're lower risk and younger to get the AstraZeneca vaccine. It's a great vaccine.
Thank you. Thank you very much. I have a question from Frances, who said her daughter is going to be starting university in September, and they're praying for a more normal guest year experience for her, in-person classes, on-campus events. What do you feel the likelihood of that would be? She's looking to be a Western or Queens, so opposite sides of the province. Who would like to take that one? You all probably, I know folks who have.
It's a hard question to answer just because every public health unit is responsible for their own vaccine rollout. And, you know, generally speaking, everyone's very aggressively working on vaccines. So it's hard to know in London to compare that to, you know, kind of how we're doing in Guelph. As you know, in Guelph, our population is smaller, but we have a really well-organized and incredibly focused public health unit. So we're doing very well with our vaccine rollout. I would say I'm hoping by September locally we'll be through our vaccines here, and Annemarie referenced that earlier, but that doesn't mean that we can all say, okay, everybody's back to class and back to restaurants and back to movies. There's going to be a slow adjustment, and it's not going to be an all-in-one. So it might be, for example, a phasing in that some people are going to be in classes and other people are going to be virtual. And then, you know, it might be a couple of days you're virtual and a couple of days in class to try and bridge things. and it'll need to be paced. We know that for sure. It's not going to be a switch. So I think that would be an important expectation to set. Annemarie, I don't know if you'd want to add anything to that.
And Annemarie, while you're adding, can I ask you to add something else to the response? Folks are asking about the delays in getting the second vaccine. Some folks who are asking about second vaccine shot already. They heard that it's a 4-month delay for the Pfizer. If you could add that to it. We know that information changes on a weekly basis. We were talking about that last night. So what you say today, things might change a little bit tomorrow. So here, that's the proviso.
Yeah. So Marva, I'll answer your question first, and then Heather or Helen, can you re-ask your question in a minute? Because it's been a long day. So yes, we are going to delay vaccines, the second shot, beyond what the pharmaceutical companies are recommending. There is now some debate starting with some people in the public health and scientific community objecting to delaying the vaccine. So that it may change. We're saying right now, yes, let's delay by 3 or 4 months. But if there's a whole bunch of vaccine that rolls in really quickly, which is now starting to happen, we may say, no, why should we delay? The quicker the vaccine that you get the vaccine, the better. But there is a corollary here, and that is that it seems like when you delay, the second shot is even more effective. So we're looking for real world information, and it's coming in fast and furious as different parts of the world immunize their populations. And it looks like, again, the AstraZeneca is 80% effective after the second dose, especially if it's delayed, and Pfizer and Moderna may be more effective if they're delayed. Trust your public health folks. These are some of the best people in the world that we have running our healthcare system. They will make the right decision unit by unit and province by province. So Helen, what was the question?
The question was, my child is going to university in London in September. Or do you think they'll be at full classes? And my answer was more like, we're going to be pacing things. We're going to, it's not a switch that we can hit where they're going to be back to normal. So that's probably a likely expectation. Just wondered what your thoughts on that
I think most universities need to get prepared now for the fall semester. And so most of them are going to make a decision not to offer back to normal for the students that are going back. It would be reckless to do so. But my guess is by September, they might just be able to, right? So there might be the possibility that they could, but they probably won't, because we don't know for sure. If everyone is vaccinated by September, and I think it'll happen before September, you are not going to need this webinar for very much longer. We're going to see a huge drop in the number of new cases, a huge decrease in community transmission, and a slow opening up of everything in the community. As long as we hold on tight, stay the course, stay on the ship, don't jump off too soon, this is going to work beautifully.
And speaking of jumping off soon, this teen has a question, which is a great question. And thank you for phoning in and signing in and asking this question. I am a teen struggling with the amount of screen time I have been getting. And to be very clear, is it okay in red to have a social distancing visit with a friend? So now that we're in the red, is it okay to have a social distance visit with a friend? Who would like to answer that one? And Marie's going,
So you know what? We all saw the Center for Disease Control in the States put out guidelines last night. Very interesting. Part of those guidelines, the changing guidelines, are meant to try to get many of the vaccine hesitant Americans to get vaccinated. So there's such division in that community, as we know, in that country, as we know, that there are a lot more people who are vaccine hesitant. So the new guidelines in the States say that once you've been fully immunized, which means you've had 2 vaccines, you can start to socialize in a very limited way with someone who's also been vaccinated. It's extremely limited. So even though they're rolling out their vaccines quickly, no one is saying, okay, go for it. So other than being 6 feet apart outside, which soon you'll be able to do, go for a walk, put that mask on and join your friend, that's allowed. But inside, not yet. The variants are out there, and we're in a race against time with the variants. We're going to win that race, but not if people start to gather outside of public health recommendations.
I was
Great,
going to say,
thank
when
you.
you apply the mental health lens to it, right, in terms of what people need, and there are
Mhm.
some people that absolutely need that contact, but you can still do it safely, right?
Yeah.
So you're still
Yep.
not putting yourself at risk. You're still not breaking the rules, but you're getting that face-to-face contact safely. And absolutely, that's something that we can all do.
Yeah.
Yeah,
Absolutely. And with the nice
absolutely.
weather, you know, that's been arriving, we have been encouraging young people to be, you know, socially distant, masked, and get outside, go for a walk with one other friend, far apart, you know, ensuring you're doing those things, because youth really are struggling and they need that social contact.
Yep,
But you
absolutely.
have to follow the public health guidelines.
And speaking of youth who are struggling, someone asked about rural youth around the hub. And Helen, I know that you mentioned a list of where the hubs are going to be located and are located. I believe that the one in Fergus is already active. Can you share a little bit about that? And Cindy has, let me just read Cindy's response if you don't mind for a
Sure.
moment.
Yeah, go for it.
Cindy said, thank you for the question, Lori. Rural youth are a priority for us. Our site in Erin is up now. Palmerston will open at the end of March. Fergus is offering online programming. We will open an additional 6,000 square feet in June. We're offering online programming and some in-person programming. And anyone who is interested can contact us at www.transformingyouth.ca. And we'll post all of that information for you so that you can have that. We'll make sure that it's on the website. Thank you, Cindy, for responding to that question. Really appreciate it. Have a question from Kathy, who says, thank you for all these webinars. I'm 70 and have registered. Today, we're hearing about folks with heart disease, diabetes, and other things getting prioritized. How does that play out? And in addition to that, Annemarie, as you get ready, I'm not going to make it too long this time, I promise. There's someone else who asked about asthma, whether those folks are being prioritized in general.
Yes. So there
Mhm.
was a quick answer to the asthma one. Yes, you're considered to have a chronic illness. So we learned this just today, that phase 2 with respect to chronic illness will be divided into very high risk, and low risk chronic illnesses. And that remains to be seen. Even the physicians in town are not quite sure how they're going to branch those out, but they are going to make sure that those with very high risk chronic conditions get immunized first, and those with lower risk chronic conditions get immunized later in phase 2. Does that answer the question, Marva?
Yep, that
Okay.
does. Yeah,
Yep.
absolutely. Thank you. Someone has made it's a question, but it almost looks like a comment. When the warmer temps come and the virus will fall to the ground faster, will we be able to be outside without masks when walking near people, but staying 6 feet apart? And I think this is sort of repeating. We still need to do our masking,
Yeah.
and we need safe distance.
I know, and I think the answer to that question about whether to wear a mask right now, when you're outside, if you're 6 feet apart, you don't need to wear a mask under the public health guidelines. Many of us are, because we're concerned about the variants. So as the weather gets better, if we don't see a surge in the variants or the development of a third wave, it will be safe to stay 6 feet apart without a mask on. But right now, because we're not really certain about those variants or whether we're starting a third wave, just keep the mask on to be really, really safe with that person you're walking beside.
That's great. Helen, when we were speaking earlier about frontline workers and what they're going through right now, and you had some comments that you wanted to make about frontline workers and the letter that Dr. Mercer, the message that she had, our CEO for public health, about really having great empathy, as Justin talked about empathy earlier on and how important that is, but also for us to really take care of our frontline workers because they are working for us. Can you comment on that, please, Helen?
Sure. So you may have seen in the paper, Dr. Mercer sent a letter to the community, and this is happening in Waterloo region as well, that our public health staff are really getting a backlash from the community. People really angry and upset and just really aggressive. It's been very upsetting, right? So if I could just step back from that part of it, if we think about what a day in the life of a public health staff right now,
Mhm.
it's really impossible for them, right? They are getting directions from Ontario on to what they need to do. They have a very limited supply. We know that's changing, but right now it's limited. They're, having to enforce rules that they didn't make. And they're having hundreds and thousands of people call them every day. They're working days, nights, weekends. They're exhausted. So I offer that just as a way of understanding and giving some compassion and empathy for our public health partners who are really managing an impossible task. Do you remember back in the spring when hospital
Mhm.
workers, we were honking horns, we were painting rocks,
Mhm.
they were heroes.
Mhm.
That's really the way we need to be embracing our public health staff right now, because they are saving our lives literally with the rollout of this vaccine. The other part of that is just for people to check their own emotionality. If you're really getting angry and, totally ripping into a public health nurse, chances are you're carrying a lot of stress, anxiety, worry, that you need somewhere to channel that to. It's not appropriate for a public health nurse to carry that, but find an outlet for yourself. If you have a box, get down to the basement, kick that around, go out for a brisk walk, pick up the phone and talk to somebody about how stressed and overwhelming this is, because you know what, it really is.
Mhm.
But find a really healthy response. I'm just really wanting to really create that empathy for our public health staff, because they're just doing a phenomenal job for us.
Mhm. Mhm.
Can I add to that, Helen?
Mhm.
I've got way too many meetings every week now. They're all Zoom meetings there with public health. There was a meeting, I think it was last night, where one of the key leaders at our public health unit was on the Zoom call before I joined, or before anyone else joined. She is exhausted. She commented on the fact that she looks and feels like she's aged in the last year. And she also said that she is not eating a healthy diet, that she reached into her fridge before this Zoom meeting and ate a piece of lettuce. That is how stressed we are. And public health does not have a say in when
No.
the vaccines arrive and where they're rolled out to. They're all deferring to the province, that's deferring to the federal government. It's coming very fast. Please be grateful. We are so lucky to have these vaccines. You will get one, you will be immunized, and this will be over. But right now, our public health workers, our frontline workers, are absolutely and dangerously exhausted. And when they receive hostile phone calls, it just makes them even more at risk for very serious burnout.
Mhm. Justin,
So the
comment?
feelings are good, but find a channel, right?
Mhm.
Go
Yeah,
ahead,
Yeah,
Justin.
totally
and well,
acceptable.
just
Find a different channel. Yeah.
no, I was just gonna say, like, in regards to that, like, all the things, all the information that comes in, you guys are only getting the information pretty much the same time that we do, right? So for
Yeah.
you guys to be able to give me information, you guys don't know until you actually apply it, right? So a lot of the time it's like, we really do need to take a little bit of a breath before people start going in on you guys like that. Like, it's tough, I can imagine.
Joanna?
Yeah, and I was just thinking actually back to where our conversation started, and Justin was talking about, and maybe you were talking about as well, the role of exercise, right? And the
Mhm.
role of, like, really, I think that stress management piece that Helen was referring to, and that's true, not like that's true for everyone, for youth as well. We've really noticed there's a big change when you're not walking to school, maybe you're not even running to school late, which we often see in our teenagers.
Yeah.
That you're like spending your time at home, you're not getting all of that regular activity, and that feeling of just like you're on the verge of exploding can be so intense. And so really engaging in the regular sleep, the eating, the exercise, like they sound so basic, but it's really important in terms of maintaining mental health.
Especially when
Absolutely.
we're cooped up at home. Yeah, 100%.
Yeah.
I have a couple of other questions, and then we're gonna ask you for some closing remarks. And this is going to be a surprise to everybody. which is really fun. I love the message that we're giving out to our public health folks, and I think we need more messages like that. We almost need to go back at this time with the vaccine, back to earlier on when we were embracing, when we were tying ribbons. I think we almost need a campaign for this, because I think it's probably going to be even worse than before. It looks like Annemarie, you wanted to say something, add something.
I'm agreeing wholeheartedly and with all my
Yes,
head
we need to start. We need to do that again. We do. And I actually have a friend who asked a question about volunteering as to what can we do to help? Is there anything? Can we hold hands? Can we bring food? Can we do something to volunteer? And I suggested just getting in touch with public health. There might not be enough people even to connect back with you immediately, but just keep trying, and maybe you'll be that person that helps to build a volunteer pool to help with the additional work that is needed and that is required. So that is something that I think we might want to put out there and try to support our public health and our frontline workers and frontline staff, healthcare workers and others, to the best of our ability. They need us now more than ever.
Our public health unit in Guelph, as you know, is on Chancellor's Way, and there's a public health unit in there's a building in every unit. We can decorate the outside of that building with flags, with banners, with thank yous, with flowers. We can't necessarily go inside the building because of COVID restrictions, but we could pile everything up outside.
Yes.
And as a person is walking into the unit, working there, man, that takes your stress down from a 10 to a 5. Like seriously, it really does.
So Guelph, let's think about that. Let's do that. Annemarie has said it. Let's do it. Let's make it happen. A couple more questions, and then we're going to go to sort of closing. That hour went by so quickly. I am in Guelph and got the shot on March 4th at the Guelph unit. This person is very, very excited about that and wanted to share that they did get that. Someone else wanted to know that her husband helps with mobility. Can he get the shot as well? And I always say, go to public health and look at the list. And if he's on that list, then yes. Annemarie?
Yes, look at the drop-down list. It is so extensive that I can't answer everyone's question. I'm not sure, but the drop-down list is really easy to review. And then the first, someone has said they had the first dose. Many people are asking, how do they make sure the second dose is booked? You will be contacted. So you are on public health's radar. It may differ from public health unit to public health unit, but for the most part, if you were vaccinated before March 10th, you would be called in at the 21 to 28 day mark. And have no fear, that will happen. These are very skilled and professional people. They know how to organize.
Right. Someone said that they called public health, so I will stand corrected, and wanted to volunteer anything to help out and was told they didn't need any, but thank you. They wouldn't need anything right now because there's no capacity for that right now. But I would say, Linda, just keep your ears open. As soon as they say, yes, we could use some help, then you will be ready. That's what I will suggest to you. And Annemarie, you just answered the question about the second dose where someone was asking, how can they book the second dose? Yes, you need to just wait to hear from public health, as Annemarie says, that you are on their radar. And as we look at our time and moving forward, I'm just going to ask our wonderful panelists for some closing remarks, and then we're going to move to wrap up. So I'm going to start with going backwards. I'm going to start with, is it Joanna, then Justin, maybe?
Yes, good.
Joanna?
Okay, terrific. So, I guess in terms of my closing remarks, we know that for young people, having a sense of belonging, a sense of hope, and a sense of productivity are really important. The weather's getting nicer. The vaccines are coming in. I think it's an important time for us to, have hope, to model good coping for the youth in our lives, all of the different youth and young adults in our lives. We need to get outside and enjoy the weather. That is definitely a mood elevator. if you are concerned about the youth in your life, it's a great idea to reach out for help. You can reach out to the resources that were flagged before. You can also reach out to your family doctor if you have one. You can reach out. There's a variety of different ways to reach out. Your youth may be tired of being online or reluctant to engage virtually, but maybe that's something that's within your capacity, and you can get some specific tips for supporting your youth. And really, by all of us working together and coming together, we're in the best position to support youth as we move through the latter phases of this really difficult time.
Yes. We are getting there to the end. Thank you, Joanna. I have a couple of questions that came in, and so let me read them very quickly before I go to the rest of our panelists. Sylvia wrote on Facebook, what about recent reports of the issue with AstraZeneca in Austria, with the death of one person and the serious illness of another? Annemarie, I don't know whether you've heard of that or something that you can comment on. We haven't heard of it, but again, just keep your eyes and ear out in terms of the news. It'd be hard to speak about something that you don't have all of the information. So I'm sure you can watch Dr. Zajdlik's Facebook as well, Sylvia, for any additional information that she's able to share. And Councillor,
tonight and try to comment on it tonight.
Okay,
yeah.
Thank you. So Dr. Zajdlik says that she will try to comment on that tonight, Sylvia. And Councillor O'Rourke wrote that University of Guelph wants volunteers for their vaccine clinics. So there's one there. Thank you, Dominique, for letting us know. That's wonderful.
Can I interrupt,
And
Marva? Can I interrupt?
yes,
you?
absolutely.
Thank you, University of Guelph. So,
Yes.
so thank you. You are putting
And also Linamar. Linda Hasenfratz has totally stepped up with the Linamar clinic as well, which is a beautiful gift to our community.
It is. So
That
both
is wonderful.
Linamar and the University of Guelph are footing the bill and filling these clinics with resources, and we would not have those resources just public health alone. So the fact that the private and public sector have joined forces in this health unit, it's just major, and I love to see it. Thank you.
It's wonderful. And we are leading the way. I hear neighboring, and when I say neighboring, I don't need necessarily, I'm not calling out any municipality, but there are people from other municipalities that are looking at Guelph and just being so excited about the leadership here and the commitment here. And I think if everybody sort of got behind that leadership, even in a more special way than you have already, it will make a huge difference and make this easier on all of us, for all of us, if we just sort of work together. Huge difference.
And Marva, I just have to give a shout out to Dr. Nicola Mercer.
Can you speak a little louder, Annemarie?
Shout out to Dr. Nicola Mercer. So our medical officer of health, you don't see people standing up and contributing unless they're following a great leader.
Yes. She is that. Wonderful. Thank you. Susan asked if there's a connection for you of Guelph. I would just phone the switchboard, Susan, and find out what direct phone number there is, or even go to the website. That would be great. Thank you. And we don't have the direct website, but if just University of Guelph, I'm sure that you will be able to find it. We'll have that for you next session for sure. And so I'm going to go to, maybe I'll go to you, Helen, for some closing remarks.
Sure.
Or Justin wants to go.
No,
next. You guys can wrestle for it. Go, Justin. Sorry, Helen.
That's all.
I just really wanted to say that coming from like a business standpoint, just how important it is for all of us to do the best we can in order to make sure that we follow all the protocols and do the best we can to help these businesses, because a lot of these guys are spending money on PPE and converting and pivoting so much in order to make sure that they can continue to service their communities. And if we can make sure that we're doing our part, then I think it will make a huge difference, and not only reducing the business owner stress, but maybe helping these businesses stay alive. So I think it's, again, just so important to have patience with staff at restaurants, have patience with other businesses, just to make sure that they have as little stress as possible and they can continue to stay open and continue to run and try to service the community. So I think that's just so important.
That's great.
And sorry to
those
hijack you there, Helen. It's just
just bring it in while you can. And when I think about even going to the grocery store, and I realize that many grocery stores are large big box store, but the people that are working on the front lines, whether it be 6 hours a day, 5, 6, 7, 8, 9, 10 hours a day, they tell you that you need your mask, or just having a little bit of patience for those folks as well. Just to add to what Justin has said, very, very important.
Yes.
And now Helen.
All right.
Really,
Hard act to follow
no
after
joke
that,
this time.
Justin Wisdom, hard act to follow for sure. So we're actually just working on a bit of a video montage for the 1-year anniversary of the pandemic being declared, which is March 11th. So that's Thursday. We're actually going to share it through Annemarie's Facebook with her permission. And it's just a beautiful 1-minute reflection. We have some visual images and some music, and it's really just meant for all of us to pause. So as tonight we're focusing on youth and families, would be beautiful for you as parents to watch with your children, or educators to watch with your classroom, and then to have a discussion and a conversation. What's the year been like? Focus on some of the losses that there has been. Focus on some of the resilience and the incredible courage that we've seen, and focus on the hope that we have for the future. I think if we can all take a minute to watch that together, and then enter into a conversation with the people that we love, whether they're the young people in our life, or whether they're our aging parents, or whoever they might be, this 1-year anniversary just gives us an opportunity to pause, to reflect, and to really connect with each other, which is something that we're all really craving.
Absolutely.
So I will share that through Annemarie's Facebook. We know she's got an amazing audience. I have 258 followers, so it won't get to many people, but she's got 25,000. So we're hoping to really share that widely. And
Yes.
Special shout out to one of our staff, Cecilia Marie Roberts, who is putting this together with a video
awesome.
company. She's just done an amazing job. So I'm very, very happy to share that with everyone.
And I thank you so much, Helen. I'm so glad. I'm looking forward to seeing that.
Yeah.
Just want to thank Allison DeMoy. Allison is behind the scenes and really make this sing. She organizes us, and we have pre-meetings before and get ourselves all ready and make sure that everything is included. And her colleague Tanya, both CMHA, Wellington, Waterloo. So thank you both so very, very much for making this a fun, informative, and at the same time serious and important conversation for our community. We really appreciate it. And we had someone who was pinch hitting here tonight for the first time. We hope we see her again in this role. We're going to ask her maybe formally. Cindy Forsyth, thank you so much for answering so many of the questions. We really appreciate it, and congratulations again as a woman of distinction. I just want to say that Annemarie?
She needs to be our next guest.
Yes, that's what we didn't want to ask her publicly. She doesn't like that very much, so we're whispering a little bit.
Pressure.
We're throwing it in the chat. We're doing that. No pressure at all, Cindy. But we'll definitely talk. This has been really wonderful, and we hope that parents out there, we want to continue the conversation with you. And even though our next session, which will be in April, may not be themed as mental health, it's always a part of the theme. So parents who might have questions, feel free to call in. We'll direct you to the right place. And certainly we're still going to be talking a lot about vaccines and everything else. So Justin Wisdom, thank you so much for being on here. Justin is my son.
I did want to say, like, just thank you guys first off for putting this all together. And I'm sure that everybody who's viewing today has benefited from this in some way, shape, or form. And, obviously you guys putting this together is just something that's been clearly amazing, and it's helped a lot of people. And I'm sure it's probably saved some lives in the process. So, much love to you guys, and for putting this together and making sure that you can do something big. It's awesome. Love it.
Thank you.
And for having me, of course. But, sitting beside you heavy hitters, I'm like, sweating a little bit, but it's all good.
I'm going to turn it over to Tracy to give our final closing. Thanks, Tracy.
It's so wonderful to have been on this journey with all of you. And so I just would like to say personally, Joanna, thank you so much. I know that you are just so instrumental for our youth. I have a 19 and a 22-year-old boy. So thank you for fighting for our youth. And Cindy, Justin, I'm a fan. I think you're wonderful. You're an amazing community leader. And you know, follow Justin on Instagram because his messages are so powerful. So thank you, Justin. And thank you, Helen and Annemarie and Marva. You guys are just, we're becoming dear friends, and it's like such a great team. And I'm proud to be a tiny piece of it. So thank you. I just want to remind everybody about the walk on July 4th to the 11th. The proceeds go towards women's mental health programs to the Canadian Mental Health Association. And so you can find that run again on www.runforwomen.ca and choose Waterloo, your city. And it's brought to you by the Love You campaign for Shoppers Drug Mart. And so we can walk, run safely with masks, outside, lots of distance, July 4th to the July the 11th, a virtual walk. So thank you for CMHA for everything you're doing for our community. So wonderful. Thank you, everybody.
And thank you, audience, right?
Yes, for wishing you
Here, you guys are just wonderful. You're the wind beneath our wings.
Come back, keep following us. We're going to be here with you. We're all in this together. You know, we're finding this COVID balance together. We're all in different places, but don't forget to ask your friends, family, how are you really? And we're in it together. So thank you.
And no t-shirts left, no sweatshirts left,
No,
unfortunately.
but you know what?
Yeah.
We should push them to print more and make some
Yes.
more money, because it was a wonderful
Yes.
campaign, and
Yeah.
and I don't think it's done yet. So that's not very fair of me to say that, but
Thanks, everybody.
right? Yeah. Okay. All the best, everybody. Thank you so much. Thank you.
Okay.
Good night.
Take care.
Bye-bye.
Bye. We're gonna sign out and sign back in.
Are we still on, or? Thanks again, Helen. Really appreciate it.
Oh, it's been great, Justin.